Welcome back to Morning Break, and today's Monday Motivations brought to you by Gates Brain Health, where today board-certified chiropractic neurologist and chiropractic physician Dr. Randall Gates is joining us to talk about gestational diabetes. I know this is a little self-serving, you guys. It's something I was diagnosed with, but it's something I had no idea how common it was until I started talking about it, and then I realized a lot of my friends had it, strangers that I've met through the show have had it, and so it is common, but it's something we don't think about until we get the diagnosis.
So true. I believe the estimates are around 14% of pregnant women end up developing gestational diabetes.
Yeah.
So that's really, really high.
It is really high.
It's almost 1 in 5.
And so what is it about pregnancy? Because this is something that occurs in women who don't already have diabetes. So what is it about our bodies as we're going through all these changes that makes it harder to break down those sugars?
Great question. So we all are walking around with a certain amount of adipose tissue, fat tissue, and we have fat tissue in different parts of our body. And what they basically know is that the more fat tissue you have around your liver and our abdomen, the more likely we are for things like diabetes and or pre-diabetes. But then we go into pregnancy where we're gaining weight and that adipose tissue is taking on more fat in essence, and there's a limit. And it seems like once we cross that limit of the threshold, then we can go into gestational diabetes.
Now the good thing is that basically as soon as this kid comes, gestational diabetes is gone. However, one of the things that the doctors are telling me about is that getting it under control now is important, not only for our health right now and the baby's health right now, but also once the baby arrives and after for me and the baby, so that neither one of us get diabetes. Is that correct?
That's absolutely correct.
Yeah.
100%. And I think awareness around this issue is awesome. I think it's so great that you're talking about this, because there are a lot of women who want to become moms. And in that time frame, that's where it's really important also to really have blood sugar looked at. And like you say, I mean, we may not be able to predict, and but by the same token, trying to lose weight before pregnancy, if there is obesity, is important.
Yeah, and then getting those blood sugars under control has been trial and error. I was telling Dr. Gates, it's been the bane of my existence, because it can be really hard. You're eating what you think is a healthy meal, you're checking your blood sugars, and it's still high, or you go on a walk and all of a sudden they're really low. And so it's kind of this game. But what are some of the foods that are really good for people to eat who do have gestational diabetes?
I think we were talking about like avocados, if somebody's not allergic, are really high in fiber. So they have carbs, but I think on average, like an avocado has 10 grams of carbs, but 9 grams are fiber. So there's 1 net carb in that avocado. And proteins are typically good. Healthy fats are good. So yeah.
Very similar to like my doctors described it as the keto diet. If anybody has done keto, where you're cutting back on a lot of your carbs and increasing your protein in your meats and things like that. So I have had my fair share of bacon, that's for sure. I have had a lot of bacon lately.
It is low in carbs.
Yes, exactly. So I've been doing a lot of that, and then the importance of exercise too. Let's just 100%. Hit on that.
Yeah, I think there are a lot of studies looking at, I think it's 150 minutes of exercise during pregnancy for prevention and or treatment of gestational diabetes, part of the multi-pronged approach. You talked about exercising after meals. There's a lot of discussion in the insulin resistance literature about that, taking a walk after every meal. How many people go to Europe and they notice they walk a lot. And there's even some conversation, if you can't walk because of the weather, doing something inside. Some people dance. I don't know about dancing for pregnancy, patients who are pregnant, but you know what I mean. So being active after meals.
Which is something that I have also learned is something I was not doing nearly enough of, because I have such a sedentary lifestyle between, you know, I sit at my desk all morning long, I sit here on the set, I go home, I sit at the kitchen table, I sit on the couch, I go to bed. That's my routine. So just incorporating that 15 minutes of walking has really helped a lot. And so I hope that this conversation with Dr. Gates is really just here to alleviate any of your fears and worries and concerns if you do get diagnosed with gestational diabetes, or maybe you're already going through it or right there along with me, because again, it can be a little scary. I've had my emotional moments and stuff, but at the end of the day, it is very manageable. Right,
and you're being very proactive. And I think it's important that anyone with it be managed by their OBGYN, sometimes a dietitian, a nurse practitioner who specializes exercises and gestational diabetes are all really important for managing this condition.
Yeah.
And then I'd also say seeing, functionally, doctors who look at this issue of blood sugar regulation very closely before pregnancy can also be important.
Absolutely. Well,
Yeah.
Dr. Gates, thank you so much for being here. We appreciate it. Thank you guys for watching. We'll be right back after this quick break.
Great.